Hello everyone, my name is EJ Obiena. I'm here today with Doc Gabe and Dr. Miguel with this Health Vote, where we jump into fundamental topics about health and wellness. Let's start. For today's topic, we will be talking about sports medicine.
Sports medicine is a branch of medicine that talks about the prevention, the diagnosis, and the treatment of sports injuries. And this includes the preparations, the trainings, the diet, and the sleeping regimens, the exercise regimens that you have to prepare for and able to be at the optimum health to perform your sport.
True.
So how did it help you in your journey to becoming a world-class athlete?
I mean, sports medicine is definitely something that we need to rely on. You know, athletes tend to be a little bit more exertive to their body than a regular person. And of course, our sports, it may be healthy overall, but it's exactly not when it's done professionally, because especially for my sport, it's very unbalanced. Therefore, I believe sports medicine is the branch of my team that really makes sure that I'm still okay. This year, as I said, you know, I've been plagued with injuries and all of these, and yeah, with sports medicine, I'm able to somehow make things work and still be able to jump and compete in Olympics.
With the help of strength and conditioning coaches, which are actually physiotherapists, there has to be a proper conditioning in order to prepare the athlete for the training course. So the training takes about months, right?
Yes.
It doesn't just happen in a few days or a few weeks. So there has to be, your body has to be primed for that and for further training and you have to be at the peak of your health by the time of the competition.
So I think even as much as sport medicine is great and amazing, accidents do happen. And I think that's where MIS doctors come in.
Yes. Far from the traditional way of treating injuries like fractures, tendon tears, meniscal tears. In the advent of minimally invasive surgery, unlike before, instead of disrupting a greater area of tissues to get to a small injury, we make keyhole incisions. For example, a tendon tear in the knee. We make 2 small incisions, maybe at the side, 2 or 3 probably. Insert a scope, about 5 millimeters, 3 millimeters to 5 millimeters scope. Assess the whole area, then repair if need to be repaired. Replace if need to be replaced, or cut off anything that has to be removed.
True.
But with the advent of minimally invasive surgery, you go through. You do not disrupt anything. You just go through the fibers of the muscle to get inside it, then operate on the patient. And now we have realized by saving these tissues that were injured, by repairing them instead of replacing them with prosthesis, it helps the joints more. It makes it more functional and hopefully returns the normal function to what you were before you were injured.
Yeah, and I think the way you explained it, minimally invasive, is very important for us athletes because we want to get back as soon as possible to the playing field. Yeah, with that, it shortens our recovery time. It really expedites our return to play.
Yes.
And with that, we are thankful to you guys for making all those progress.
And it's shorter time and less pain.
Yes.
Not without pain, but less pain.
True. I remember my meniscus cleanup back in 22. I was an outpatient. I was walking right after.
Yes.
It's incredible.
Unlike before, you'd have to stay in the hospital for days to weeks.
Yes.
You have to immobilize it for a couple of days, a couple of weeks.
Yeah.
Unlike now, after the operation, you can use it right away with caution.
So basically, you also make their job a little bit easier because then the atrophy is less.
Yeah. We work hand in hand.
Exactly.
Right.
That's why we're here.
Yeah, it's more of a collaboration, really.
For me, as a sports medicine specialist, you have to be honest with your doctor. If there's any even minimal symptoms or anything that's painful, anything that hurts, anything that impedes you from doing what you usually do, just tell your doctor. And a good doctor will tell you if you need surgery, you need treatment, or if you don't. Yes.
So I would rather that instead of relying on your gut feel, ask the specialist. always ask the specialist. Nothing is too small.
Yes,
I
because
agree.
that's the problem sometimes as athletes. We try to endure everything, we
Yeah.
try to go through everything, try not to complain about small things, but sometimes those small things build up into a bigger problem later on during your training. It might even stop you from competing. So even if you have small problems, you can immediately consult the physician just to have it checked, just to make sure it's covered and it doesn't blow up into something that's big that will be able to impede you from competing.
Thanks for joining me in this episode of Health Vault. Don't forget to like, share, and comment below, to follow Lourdes Hospital and all their socials to be updated about their latest updates and posts. Finally, we're done. I think we're good.